Recording. There we go.
Awesome. Well, hello everyone, and thank you for joining us. Welcome to our educational webinar, Protect and React with Plant Medicine. My name is Johnny, and I'm the National Sales Manager with St. Francis Herb Farm. I'd like to introduce you to our host for today's webinar, Dr. Brianna Lutz. Dr. Brianna is a naturopathic doctor and registered herbalist based in Edmonton, Alberta. She delivers naturally focused medical treatment with a special interest in women's health and hormones. With an expertise in botanical medicine, she educates on the clinical application of herbs as the brand education manager and medical advisor for St. Francis Herb Farm. Dr. Brianna, the floor is yours.
All right. Well, thank you, Johnny, and welcome everyone. I appreciate you joining me this evening. So Johnny is going to be functioning as a panelist with me this evening. So I'm just going to go over a couple housekeeping items. So I just want to make sure that everybody can see my slides. So if you just want to pop into the chat, say that you can see my slides. I also have other windows open, like the chat box and Q&A box. If that's impeding your vision or you can see that, just let me know. But otherwise, thumbs up, Johnny. Everything looks good on your end. That looks okay. Okay, you see my slides and then no other windows in your way. Okay, super. Excellent. I'm on a different computer. I had some water damage on my laptop. So appreciate everyone. Okay, excellent. Getting all the confirmations there. So feel free to engage in the chat throughout the presentation. I won't be checking the chat as often, but Johnny is going to be monitoring that. If you have questions, I would recommend popping them into the Q&A box. That way we can make sure that all of the questions are consolidated. And then I'll be periodically checking into the question box so I can either answer questions at the end of a slide, or if I know I'm coming up to that topic or I'm going to be talking about your question in a future slide, I might just pause and wait till I get there. The goal for me is also to finish a little bit earlier, so about 1:45, so then I have an opportunity to answer any of your questions. I know last webinar, there were a lot of questions, so we took some time to unpack a lot of that, especially when it came to herbs and immune health. And I think people were just really excited to be on a webinar. So thank you so much for being here and engaging with me as well. So also, as I mentioned, I have some discrepancies in slides. So this is Protect and React for your immune system. So this is all about how plant medicine can be supportive for your immune system and how we're looking at a strategy to manage the immune system. Okay, so there's going to be a threefold strategy to look at how we're going to actually address the immune system, where I think there's a lot of confusion around what do I need to take, what herbs are relevant, and accessing that information here. So there's a question, will you be sending us the recording? I'd like to read and understand more. I know that this is being recorded. I'm not sure how Healthy Planet distributes that or has access to that, but I do know it is being recorded. You're being recorded right now. So I'll maybe leave that to Johnny. Johnny, do you have?
Yeah, they're sending an e-blast afterwards with the recording.
Okay.
So if you're signed into their e-newsletter, you'll get a copy of that. If not, I'd recommend going on their website, signing up for their e-newsletter, and that way you'll get the recorded copy.
Yeah, perfect. Thank you for that clarification. That's great. Okay, so just a little bit about St. Francis Herb Farm. So we are a proudly Canadian company, family owned and operated for over 30 years. We started actually on Vancouver Island, and I always tell it was two herbalists that fell in love and started this herbal company. They were harvesting, growing a lot of their own herbs on Vancouver Island. And then when they wanted to expand this company, they wanted to get a larger farmland, and obviously land prices on Vancouver Island aren't cheap, and they relocated to the Ottawa Valley to grow their own herbs. They first started with servicing or supporting the naturopathic community, so naturopathic doctors, and then in growing the company, looked to actually support consumers. And our goal at St. Francis is to empower people on their wellness journey only through effective plant medicine and education such as this. So I think that information is power. I think that herbs are an effective ally to have with us, and you can trust in St. Francis Herb Farm when it comes to the quality and the craftsmanship from our products. So as I mentioned, some of the slides are kind of irrelevant, so I'm just going to pop to our Defend with Plant Medicine. This I think will be a little bit more geared towards active infection and less about prevention. I know our previous webinar that we did with Happy Planet, that was more about the deep immune family and really supporting and optimizing immune function when it came to prevention. So when it comes to prevention, we look at supporting what we call the innate immune system. Okay, the innate immune system is the immune system that we're born with, and this is a quick action and a general response. So this involves basically all of our mucous membranes, so anything that's exposed to the external environment, such as our entire digestive tract, such as our respiratory tract, our skin, and all of our bacteria and microflora in all of those areas. This is also, like, fever is part of a strong immune system as well, or part of our innate immune system to be able to mount an effective response. And again, a more general response depending on what we're exposed to, right? So our innate immune system, like I mentioned, is something that we're born with. Used to be believed that this was just established when baby exited from the uterus, whether that be through vaginal birth or exposure post-cesarean. But we're realizing that the womb or the uterus isn't necessarily a sterile environment, and we're developing some of these immune components actually in utero. Then the immune system is going to be built definitely in those early times in life. That's from skin to skin contact, that's from breastfeeding or chest feeding, incorporation of like breast milk, so even that's being bottle fed, and that's also from various immune exposures. And our immune system isn't necessarily fully developed until we're about 18 months or 2 years old. And that's when I find typically we're incorporating or safe to incorporate certain herbs for kiddos. So a lot of times when we're looking at some of those herbal recommendations or product recommendations for kiddos, that's one of the reasons that we're doing that, is because we're supporting that immune system at that 2-year standpoint, especially when it's involving particular herbs that are going to stimulate the immune system as well. So when we're looking at the innate immune system, as I mentioned, it's all about being proactive and developing a strong or balanced immune system. And when I say a balanced immune system, that's going to be our strongest immune system, right? We don't want an overactive immune system where we're reacting to things that we shouldn't have a response to, like cat dander or pollen in the environment, or our own tissues like our thyroid or our digestive tract. But we also don't want an underfunctioning immune system where we're seeing a higher incidence of cold and flu, ear infections, or I like to look at the immune system as like a huge spectrum, where like one end of the spectrum is going to be complete immune suppression or an underactive immune system, where we're seeing, people on immunosuppressants, or we're seeing people with cancer or things that we're not able to mount an effective immune response, versus the complete opposite end of the spectrum, where we're seeing overreactivity, and especially in the cases of autoimmune conditions, where we're not able to distinguish like what's harmful and what's like an invader or bacteria or virus, and we're confusing that with our own tissue. So autoimmune, we're attacking our own tissue, such as our thyroid, such as our joints, such as our digestive tract, right? So when it comes to these supporting or balancing the immune system, we can look at herbal compounds called adaptogens. Now, adaptogens, and it's right in the name, it helps us to adapt. And that is not only from a stress standpoint, where we're looking to regulate cortisol, which is one of our main stress hormones, but this is also looking at the immune system and balancing or adapting there. So any adaptogen is going to have some benefit on the immune system, because we know that cortisol and stress hormones can interfere or alter our reaction of our immune system, right? That's why like we see higher incidence of like cold and flu around Christmas time, because it's like the hustle and bustle, or you're getting those deadlines done for end of year, or getting everything prepared. And then like the minute you have a time to relax and have a break, it's like, bam, that's when we get sick. So any adaptogen is going to be beneficial for the immune system. However, immune adaptogens are a little bit more specific with the immune system and help bolster or support specific components of the immune system. Now, this could be various white blood cells, including macrophages. So macrophages are like the little Roombas of our immune system. So like monitoring and kind of clearing up debris. These can be particular immune cells that might be more specific to viruses or bacteria, and basically looking to mount an effective immune response. So our specific immune products for this innate immune system, we're all about building that strong and balanced immune system, is going to be related to the Deep Immune family. So we have our Deep Immune Original, which is one of our longest standing products at St. Francis. I think that's one of the products that we're most well known for. And this is a synergistic immune adaptogen support that we're looking to take proactively to prevent getting sick, or to calm an overactive immune system where we're seeing, again, allergies, eczema, or an overactivity of the immune system. Vitamin D is also grouped into this approach to supporting an innate immune system. And vitamin D, again, is one of those balancers. So in autoimmune conditions or overreactive immune systems, we want to make sure that our vitamin D is not only sufficient, but optimal. And typically, I recommend people getting tested for their vitamin D status. I don't know necessarily what it's like out in Ontario for actually checking your vitamin D status. Where I practice in Alberta, you actually need a medical exemption to test your vitamin D levels. And so we do private testing in our office. So we're actually able to recommend the appropriate vitamin D dosage. And again, not treating just to sufficiency, but optimal levels of your vitamin D status. I wouldn't go willy-nilly with vitamin D supplementation. We've seen, and like as a profession, we've seen probably the most number of cases of actually toxic levels of vitamin D in people's systems. So we look to test to figure out that optimal level for people. But the general recommended dose actually has increased. It used to be 1,000 international units daily, and now the recommended daily allowance or dosage is 2,500 units. So that is a general recommendation to people to start and maintain that level of sufficiency if their vitamin D is already sufficient. If we're deficient, again, we're probably having to correct for those levels of deficiency with potentially higher dosages. Okay, so that's all about prevention. Okay, and I appreciate bearing with me where you don't have many other visuals other than me talking at you. But now we're shifting into the mode of what happens when we actually get sick, right? And especially when it comes to cold and flu that might be viral in origin, we don't see necessarily antibiotics being effective, right? So with that, I don't know if you've had that marketing campaign, like not all bugs need drugs, right? So bacteria are going to need or can need particular antibiotics, time and a place for everything. But again, with a lot of cold and flu that we're talking about in the sense of immune support, and especially plant medicine for immune support, they're often viral in origin. So we're wanting to have altered strategies for how can we stimulate the immune system and help to mount an effective response? And B, how do we go after the actual offender, right? So we'll go after the actual virus, or we'll go after the actual bacteria if it's a bacterial infection. And plants are a really good way to do both of those things. And then from there, we're going to talk about stimulating the immune system, and then how we can diversify in treatment based on the various symptoms that somebody is presenting with, or the type of infection that's actually present as well. Okay. So defend with plant medicine, our reactive approach. So we're going to stimulate the immune system. Okay. I just want to pause for a second, just make sure everybody's following here. Same in Ontario. I think that was about the vitamin D testing. Potentially. Okay, super. Yeah, it would be helpful if we could test our or have greater access to testing our vitamin D levels. So I would say that treating to or maintaining that RDA, or that recommended daily allowance, is going to be important. And I think there's some misconception too about always getting vitamin D from the sun. And people are like, oh, I don't need to take vitamin D in the summer, right? Because I'm out in the sun. You actually need full torso exposure for a minimum of 20 minutes without sunscreen to actually get enough vitamin D for that daily allowance. Now, I don't know a ton of people who are topless sunbathing, especially in the summer. And so for me, like I typically am recommending that people are maintaining or continuing their vitamin D supplementation throughout the summer. And individuals with like higher melanin or pigment, so individuals like people of color, for them, they actually have a greater risk of being deficient when it comes to their vitamin D, because they don't actually metabolize it. They metabolize it different, or they're at higher risk for deficiency. Pregnancy is a high demand on vitamin D, and we're seeing like vitamin D status being connected to a lot of like gynecological conditions as well, fertility issues. So it's a very innocent molecule that has a very large impact. And I know we're here to talk about herbs, but certainly I think vitamin D is really important. I just have a question. So what's the daily allowance or recommendation for kids? So this is going to vary per age. And oftentimes pediatric dosing will be around 400 international units. And that would likely be up until kind of that cusp of like 2 years. Sometimes I'm modifying that daily allowance per kids by weight. Sometimes it's by age. And then we're switching to more like the 1,000 international units for like that child's dosage versus infant dosage, which is the 400 I use. Yeah. Okay. And one thing is that if you don't know and you're kind of shooting in the dark with dosage, Health Canada will regulate this in terms of recommended daily allowances. And so products are going to be geared towards that. So I think that's a good marker of discerning what's a good product. Like if somebody has a vitamin D2, don't buy that company, because that's old research. The active form of vitamin D is vitamin D3, and if a company still has D2, then we're not up on that literature, that research. It's just rolling out that a lot of supplements are switching over to the 2,500 units. I know a lot of the professional grade products are that 2,500 unit, but I think it's just rolling out to more consumer stuff that is the 2,500. Yeah. Okay. So this, and if you've heard me speak before, you know how much I love bitters. However, this is a very close contender for like my top or favorite St. Francis product. Echinacea is a fantastic immune stimulant, okay? This is going to be when we would think of starting echinacea or echinacea is going to be like the first sign of infection. And that will vary from individual to individual. For me, it's like that slight tickle in the back of my throat where I'm like, oh crap, I'm going to get sick. Some people, it might be like the little body aches, or it might be like it goes to their chest and they start get a little bit wheezy. Maybe their energy drops, and like, especially like post travel where you're like, yeah, my energy is suppressed a little bit. I feel like I'm starting to fight something off. That is your first sign of like, okay, I need to stimulate my immune system into action. So this is a combination, a formula of various different immune herbs, and they're going to have benefits for certain aspects of the immune system. So as I mentioned, our strategy of being of stimulating or being reactive with our immune system is how can we stimulate the immune system into action, and how can we work on the actual infection or issue. And then what I think is a beautiful benefit too of botanical medicine is what kind of symptom relief can I get from this as well. And I think that's a marker of a really good intervention, is that we're kind of covering all three of those. So this was going to feature antimicrobial herbs. So antimicrobial means that they'll work on multiple things. So it could be that they're working on viruses, could be that they're working on bacteria, different fungi or yeast. So it features different antimicrobial herbs and immune stimulating herbs. Now, this is going to include probably the most well-known herbs to you, or probably that you've heard this before, echinacea and golden seal. Now, on our products, and I'm sorry that this slide doesn't reflect it, you'll notice that there's a sticker that's going to say 2+ or echinacea 2+. And what this means is a lot of our cold and flu products are going to contain 2 species of echinacea. And why this is important is that both species of echinacea actually enhance the action of one another. So what that does, it actually looks to make the echinacea more bioavailable, meaning our body can more readily absorb and utilize that plant constituent. And the other benefit is that it's going to keep that constituent or chemical compound in that herb around longer. So you have a greater or more prolonged action of that herb on the immune system or on bacteria or on the actual infection. So again, a unique formulation of echinacea that actually has the right extract of echinacea and the right combination of echinacea. And then we see this shortening the duration of colds and flus, shortening the intensity of cold and flu as well, and also looking for better symptom relief as well. Now, this is paired with golden seal, and golden seal is a fantastic, again, antimicrobial and immune stimulating herb. If anybody has tasted it, I don't know if people can pop that in the chat. If you've tasted golden seal before, it's quite an abrasive herb. I'm not gonna lie. Usually if I'm at a trade show or at a conference and people come to like try a tincture for the first time, I'm not gonna give them golden seal right off the hop. But again, we'll talk about kind of the other herbs or the benefits of the other herbs in the formula to be beneficial. Okay, so echinacea, we talked about being the immune stimulator. Golden seal is a really fantastic antimicrobial. And one thing about golden seal is it's actually an endangered herb. So one thing that makes St. Francis unique in our golden seal is that it's sustainably cultivated. And what that means is that we actually have this genius farmer who has perfected the cultivation of golden seal. So we're not harvesting or wildcrafting from the wild or from various forests where we're actually endangering the plant population, because golden seal is a very finicky plant to grow. It likes to thrive in those different wild environments. So the fact that we're sustainably cultivating is supporting the effective herbal mechanisms without creating an ecological deficit in creating these. And then I'm just going to pop to the next slide. I know there's some questions coming up, but I'm just going to pop through these ingredients real quick, and then I'll get to some of those questions as well. Okay, so we talked about echinacea, we talked about golden seal, and then the other herbs within this formula are meant to be antimicrobial and immune stimulating. And what's really cool about botanical medicine is that plants have a tissue specificity. And what that means is, yes, we could have 6 herbs that are antimicrobial, but this one is antimicrobial better in the lungs, or this is an antimicrobial that's better or more effective for the urinary tract, or this one's more effective for the digestive tract. So when we look at the tissue specificity or where these herbs are going to act, boom, like right here, this upper respiratory tract. So especially if like that sign that you're going to get sick goes straight to the throat, echinacea is your jam. Like, I think this would be a really good intervention. Again, tissue specificity, especially for this upper respiratory tract. So again, bit of an abrasive profile with the golden seal, but with the propolis and the cayenne. So propolis does have immune supporting benefits and it is antimicrobial, but it adds a slight sweetness to the formula. And then the cayenne is a little bit more spicy, again, kind of alters the flavor profile slightly, but it's a very warming herb and it's a very circulation stimulating herb or circulatory stimulant herb. And what that does is it not only looks to break up mucus, so we can help to recover from the infection faster. But when we increase circulation, we also look to increase the mobilization or the recruitment of those white blood cells that are going to fight off the infection, right? So we want to have good circulation to that area, good lymph drainage or drainage of all of the different immune tissue. And then we want that action again on alleviating those symptoms as well. So I think it kind of, if you've done a straight golden seal before, this is a little bit easier than a straight golden seal. And if you're like a diehard like me, like I love this product. And especially if you find like there's that issue like in the throat infections, upper respiratory tract infections, if you gargle it in a little bit of water and swallow it, because you get local action of the echinacea, because echinacea is most effective for bacteria when it's on contact. Again, it's still going to stimulate the immune system, but if you can gargle and then swallow, like it works like a charm. And I think it's a really, really fantastic product. If you just need to plug your nose and do it in a little bit of water and down it like a shot, that's perfect too. I just like getting the medicine in people. Just a personal story about the echinacea. So when I started working for St. Francis as their student rep in 2015, so like I mentioned, I would just get the infection in my throat. That's my first telltale sign that I would get sick. I'd take echinacea, try and nip it in the bud, and I have not progressed to a full cold or flu since 2015, since I started working for St. Francis and have used this product, with the exception of COVID. And again, it managed my symptoms. I was more so like I had to, working with patients, I had to stay at home, but my symptoms were completely manageable. But yeah, since 2015, have not progressed to a full cold or flu. So really works. Okay, so I'm just gonna get to some questions. Okay, so we talked about the vitamin D recommendations. Can you take these herbs if you're diabetic? So I'm going to say it depends. And I know that's everybody's least favorite answer when it comes to depends. A lot of herbs, when they're contraindicated in diabetics, it's because it has what we call a positive interaction. And what that means is there are herbs in the formulation that are also effective at lowering blood sugar. So if somebody is on medication, metformin, they're on insulin, and we're looking to bring down blood sugar, and then you also take herbs that bring down blood sugar, too low of blood sugar is not good. So I would say like there's caution in that. So it's not that you can't necessarily use these herbs. It's that we might have to monitor your blood sugar more frequently, or and especially in my case in practice, you might need less medication, right? So that positive interaction isn't necessarily a bad thing. Again, it's just if we don't want your blood sugar getting too low. Same thing with a lot of blood pressure herbs, is that the herbs also lower blood pressure. Again, too low of blood pressure isn't good. We don't want you fainting or falling or fracturing a hip. So for us, it's usually that positive interaction. So I would say it depends, and you can chat with somebody who's experienced in those medications as well as herbs to see if it's safe for you. The one that does that is actually the berberine and golden seal, that effectively lowers blood pressure, and that's usually why there's an issue with that. But that's a really great question. Okay. So there's a question about can recommend these declines with autoimmune disease. Again, the short answer is it depends. And that's why I like talking about the immune system as a spectrum, for like the super under functioning and the opposite end of the spectrum where we're seeing really overactive immune system. Those are areas that defer them to their practitioner who understands the medication and the thing that they're on, and as well as understands herbs. Autoimmune conditions, because we're, again, depends on the type of autoimmune condition they have. It depends on if they're relapsing or remitting in their condition. It depends on the medication. So my short answer is no. You don't want to recommend these various immune herbs in individuals' autoimmune disease. Vitamin D, yep, you sure can. Yep. But some of the herbs, I would say just defer to their healthcare provider to help manage that.
Dr. B, we got a question in the chat.
Oh, sure.
About autoimmune, but if they are in remission or if they have low white blood cell count.
Depends on the autoimmune condition. So there's certain and have low white blood cell counts. Interesting. It depends on or the low white blood cell counts. Yeah. So generally, a lot of immune herbs are going to be beneficial for low white blood cell counts. Again, it depends on why they have low white blood cell counts, because some cases these herbs are actually contraindicated, and we don't want to stimulate the bone marrow. We don't want to stimulate the white blood cell production. So in those cases where it's super low white blood counts, related to disease, right? Like if somebody has had but if somebody is just kind of like flying under the radar when it comes to their white blood cells, or it's a chronic issue and it's been investigated, then certainly you could use like the white blood cell counts there. But the autoimmune, same thing. It depends on medication, relapsing or remitting. And I'm not sure if I said medication or like just the type of autoimmune condition. So I'd say just defer to their practitioner for that.
They were relating to Graves' disease.
Yeah, and then with the med they were taking, again, it could interact with the medication. So the short answer is no. I wouldn't necessarily recommend it for those individuals. Just defer, and then make sure that their whole case is being taken into consideration with these various immune herbs. Yeah. Okay, so we talked about autoimmune. So can you take a kinesil with slight high blood pressure if you don't take blood pressure medications? Yep. Yeah, I'm fine with that. You betcha. Okay. Sure. Okay, I'll come back to that UTI question at the end. Okay. All right. So moving and grooving along. Okay, so now we're shifting into a more developed immune strategy. And if somebody does really well with the echinocele, and I'm also going to just mention, I'm going to pop back to the slide. Sorry if I'm making you dizzy. In this stimulate section, we have a variety of echinacea products. Okay, so echinocele is, I'd say, like your heavy hitter. It is such a well-rounded product and a fantastic immune stimulant that I would personally reach to that first. Now, if we're looking at different populations that might need some other considerations, like kiddos, we have a couple options now. So we do have the echinacea for kids, which is a tincture similar to our other products. That is our Echinacea 2 Plus, and it has other herbs to help support and stimulate the immune system. Now, really exciting. We just launched a new product, and it's Echinacea 2+ for kids with elderberry. And not only is the elderberry fantastic when it comes to being antiviral or a really great immune stimulant, in conjunction with the 2 species of Echinacea, which is, I'd say, like our secret sauce, it is also alcohol free. Okay, and I know there's been a lot of requests for those for kiddos that we don't want to administer a tincture. I use tinctures in kids all the time, and I feel very comfortable and safe with using the alcohol and tinctures based on the dosage that I'm giving kids. But the benefit, and I will talk about like an alcohol-free version, we still use alcohol to extract the medicinal constituents. And for herbs, especially echinacea, you need a very high percentage of alcohol to actually extract those constituents from echinacea. And those constituents are important for the immune stimulating properties, the antimicrobial properties, for a lot of the symptom relief associated with those infections. So we use alcohol to extract those constituents or those chemical compounds in those herbs, and then the alcohol is evaporated off. So you're getting the efficacy of a tincture, but in a tastier version for the kiddos that they can actually take and is quite palatable. I actually got to try this recently. I know we did our first run and then we're on our second batch. And we still get the really nice echinacea tingle. I don't know, you can pop in the chat if you know that echinacea tingle. And that shows like the efficacy of a really good echinacea. And those are those what we call alkamides, where we have to use a high percentage alcohol to extract those. And that tingle of those alkamides is what gives it represents kind of that stimulating property of the immune system. So quite tasty. The elderberry is really nice. There's also aronia berry in there as well for flavor and antioxidants and immune fighting properties, but you still get that little tingle of echinacea at the end. Yeah, so those, and then we also just have straight what we call a kinase. So it's the 2 species of echinacea on their own in a tincture as well. Okay, so we talked about kinesil, talked about those ingredients. Okay, now we're shifting into a varied strategy as well. Okay, so this is where I like to then shift into where people are having like more specific symptoms. Okay, so you could always start somebody on the echinacea, again, stimulate their immune system. And then we could either use it conjunctively with other formulations that are, again, either more tissue specific or infection specific. And so Risper Effect, and I think, let me just double check, Risper Effect, Sign Effect, and Risper Effect, which we'll talk about all 3 of those. So Risper Effect would be more specific to like types of viral infections. And we typically see this with fever. And we can see that with like body aches, malaise, or tired, and is fantastic. And I would say is probably the most specific antiviral herbal formulation that I've seen. Now, a lot of products are going to market as being antiviral, mostly because they stimulate the immune system. Right? So your immune system is antiviral, right? Your immune system wants to be killing off the virus or preventing the virus from replicating. So any type of immune stimulant is going to be antiviral, but this has specific herbs such as andrographis that is not only going to stimulate the immune system, but works directly on the virus, preventing viral replication. So I think that's a really important distinguishing factor is you're getting both of those benefits. You're getting the immune stimulating aspect. So how well can your immune system mount an effective response to that virus? And can we go after the virus itself? And andrographis is one of those unique herbs that actually can do that. Andrographis is not for the faint at heart. It is king bitter. It is, I have a very high threshold for things that are gross that I know are good for me. Andrographis, my relationship is like snuggling a cactus. Like, it is not my favorite herb, but it works amazingly. When I like when everything shut down in the panini, we say the panini so we don't get censored. When everything shut down, I didn't have my echinacea. I used andrographis, and it worked fabulously. And I sucked it up and I used it. Again, with tinctures, put them in a little bit of water, take it like a shot, and you don't have to taste it or prolong the effect of that. But the Var Effect is a really fantastic herb. Caitlin, who's part of the ownership family at St. Francis, for her, when she gets, so for me, when I get sick, it goes straight to my throat. When she gets sick, she finds it like goes to her muscles and her joints. Like, she just feels like those body aches. Var Effect, boom, that is her combo. And it just like nips it in the bud and prevents that viral replication, and how her body is creating that immune response to the virus. So like I mentioned, you can use the echinacea and the Var Effect together. If somebody shifts to more of those symptoms, like, I will usually shift them to the Var Effect and stop the echinacea. But again, you can use both, or you can switch to the Var Effect. So this has andrographis, wild indigo, our echinacea, holy basil, lomatium, thuya, which is cedar, and phytolacca, which is poke root. So really, really fantastic agents, not only from antimicrobial, immune stimulating, antiviral perspective, but also really great for supporting our lymph tissue. So actually flushing out that infection and looking to resolve it, which I think a lot of other products kind of miss. And I think the lymphatic system is really important for recovering from infections, especially those infections that just kind of like linger on. Like, look to your lymph tissue and look to resolve that from a lymphatic perspective. Okay, just gonna check. And then, is it okay to blend echinacea with Var Effect and Risper Effect together as one tincture combo? I don't think there's any issues with combining them. I'll when I get to the ingredient slide for Risper Effect, I'll just check in my Rolodex in my brain if that's a good combination. But off the top of my head, I don't see there being an issue of combining those. Okay, so sign effect. Okay, so this is if the issue or the infection goes specifically into the sinuses. So that'll be like pressure or pain here and in here. So your sinuses are here and they actually extend quite high into the head, into the forehead. And typically with sinus issues or sinus infections, we're seeing like thick mucus or like nasal discharge. Sometimes they're really fun colors as well. And we know that there's a sinus infection associated with that. Sinus effect is still useful for like upper respiratory tract infections, and then ones that will shift into the sinuses. This can also be effective for hay fever and allergies. And typically we're rotating that with either Oreganum Plus, which is a capsular combination from us, especially if it's a persistent chronic sinusitis. But when we talk about tissue specificity, again, like how specific can we be with those antimicrobials? This has a herb called eyebright or euphrasia that just elevates that tissue specificity, like particularly to the sinuses, probably even better than echinacea or some of the other like upper respiratory tract herbs in the echinacea does. So if somebody has issues, they go straight to the sinuses, then I would recommend the sign effect in particular. Okay, Risper Effect. So this is if the infection tends to go to the lungs. Like, this is my mom. Like, whenever she gets sick, goes straight to her lungs. And so if there is excessive mucus and there's issues actually expelling or breaking up that mucus, sometimes we'll hear it as a wet cough or productive cough, acute bronchial conditions, this would be really beneficial. what is also really great about Risper Effect is that it has herbs that are what we call demulcent in action. So they're looking to coat and soothe and protect the tissue, and create that mucus, or create protective mechanisms to prevent that inflammation and irritation in the lungs. So people are like, oh, like it just hurts, like I can't cough anymore. Like demulcent and anti-inflammatory herbs are really helpful and important for that. So to get to that question about combining a kinesioid effect and Risper Effect, no, I don't see any issues with herbs that would interact with one another. No, no, I don't. No, you can use all three together. Yeah. I would probably, if somebody's like, yeah, they deal with the infection in their lungs, I would maybe do a kinesioid to the Risper Effect. And then depending on the type of cough, that's when I would want to jump to, say, the elderberry cough syrup. And what is unique about the elderberry cough syrup? So yes, it has elderberry, which is antiviral and like immune stimulating. It also has wild cherry bark. And wild cherry bark has this kind of paradoxical application in that it stimulates an effective cough and suppresses an irritating one. And what I mean by that is your body has natural mechanisms of helping to expel mucus and congestion in the lungs. It's called your mucociliary escalator. Like I get awesome visuals when I think about like that word. So this mucociliary escalator is helping to move mucus out of the lungs. So when people feel like, oh, it feels heavy, it just feels like there's something stuck, I can't cough it out. But it irritates, like I said, suppresses an irritating cough. So that dry cough where nothing's happening and it's just you constantly have to cough and cough and cough and cough, and again, nothing is happening with that. It looks to work on both of those. So, and because I know a lot of people say like, don't suppress a cough, but if you're not sleeping because you're coughing, right, we want to calm that ineffectual, inefficient, irritating, raspy cough, but promote a productive one where you can actually expel that mucus and the associated infection with that. The adult version of this cough syrup also has a herb called lobelia. And what lobelia does is looks to open the lower respiratory tract. So when people are like, oh, I feel like I've been coughing so much, I just like can't catch my breath, or I find it really hard to breathe, or like just feels congested in my lower lungs. Lobelia is fantastic for opening the lower respiratory tract, and it's fantastic that way. Yeah. Okay, so perfect. And the elderberry cough syrup. Okay, so I'm just going to talk about the throat spray, and then I do want to open it up to questions because I feel like I want to field that. But this product is dynamite. Yeah, this is a fantastic product because it looks to deliver the medicine on contact, right? Like, you know how I talked about like gargling. Yeah, Johnny's holding it up. And at the CHFA trade show, like this is something that we always bring because we know people talking and kind of fighting stuff off, that having that sore throat relief is really important. Not everybody can have like a lozenge or things that they're using for that. So this one delivers obviously the medicine right on contact. So the echinacea, like I talked about, super effective and supportive of getting rid of the infection when it's on contact. Again, you still get some of the stimulating benefits, but this throat spray also has those demulcent herbs again, so coating, soothing, and protecting that tissue. And what's also unique about echinacea that I didn't talk about is that on contact, it actually blocks pain receptors. So if you're familiar with like cayenne or capsaicin as like those arthritic rubs and things like that. Cayenne blocks pain receptors, so you release all this substance P, or your pain substance, so then that receptor is overstimulated and you can't perceive pain. Echinacea does that 20 times more powerfully than capsaicin or cayenne. So for sore throat or irritated tissue, echinacea is beautiful when it comes to actually relieving that soreness aspect or that pain associated with that infection. I've tried a few throat sprays in my day. I have not liked all of them, but I do really, really love the taste and application of this particular throat spray. I think it's really great. Okay, so I'm gonna just kind of run past this chest balm here. This is essentially a natural version of Vicks, right? So again, opening those respiratory tracts and helping to increase circulation to break up mucus in the lungs. So, okay, so I have some questions here, and then you can pop them in the chat as well. And then Johnny will also help me to field some stuff. Sorry, my chat box is just not, oh, there it is.
And just before you do get into questions, I just want to let everyone know if anyone's interested in any of these products, Healthy Planet is running a sale on their website right now, 20% off all St. Francis products. So feel free to go to the website if you're interested in any of those.
Mm-hmm. Okay. Awesome. Thanks, Johnny. Okay, so I'm going to get to the Risper Effect question first. So since Risper Effect has licorice, is it safe with clients who are on blood pressure medication? Short answer is no. So our general recommendation is anybody who has high blood pressure and is on blood pressure medication, that we avoid licorice. And that's why we like with our deep immune, because deep immune, one of our like ingredients to support or to be an immune adaptogen and antiviral is licorice. So we actually created a deep immune that is licorice free. So for those individuals who have high blood pressure or are on certain medications, and that might be a suitable alternative for them. And remember, we're being proactive with the immune system. I think that's really one of the biggest, I should say one of the biggest takeaways, but definitely I think feeling empowered that we can strengthen our immune system and we can create balance within the immune system. And it doesn't need to be like a constant fear of like, oh crap, I'm gonna get sick. And I don't know about, so in Alberta, like we've been seeing a really bad flu going around. It's a respiratory thing and it's lingering on for like a month. That has been pretty prevalent. I know a lot of the daycares, like hand, foot, and mouth was becoming an issue. So kiddos are sick, like kind of back to back. And I think while social distancing may have been a beneficial thing during the panini, we're seeing some deficits in people's immune system because it hasn't been challenged, right? So part of developing and strengthening immune system is various exposures. If you're interested in stuff for kids' immune health or just understanding this innate immune system, there's a really great book. So I'm just going to put this in the chat. So Let Them Eat Dirt. And how sometimes too clean of an environment is actually reducing our immune efficacy. I think it's a really great book, especially for parents of young kids, but I think it's a really good way to start understanding that innate immune system. So that was, oh, go ahead.
Is it Let Them Eat Dirt?
Yeah, okay. Let Them Eat Dirt. Yeah. Mm-hmm.
You wrote Eat Them Eat Dirt.
Oh, sorry.
So I just wanted to make sure we got the title correct. So.
Yeah, Let Them Eat Dirt. Okay, eat dirt. I was doing too many things at once. Let them eat dirt. Eat them eat dirt. Oh my God. Okay. Yeah, don't eat them, but let them eat dirt. Thanks, Johnny, for that catch. Okay, so yeah, that was a long-winded answer of saying, like, short answer is no when it comes to licorice and blood pressure, and then with blood pressure medications as well. Okay, okay, so I'll get to.
There's a question in the chat here.
Yep.
Around overactive immune system.
Okay.
So if a person has allergies and therefore an overactive immune system, can they still take these products which you've talked about as immune stimulants?
Yeah, that's a really great question. So when we're looking at immune stimulants, there's two different levels to the immune system. So the innate immune system is our deep immune system. And that is oftentimes what's creating the balance and discerning like what is or what is not us. Okay. Now, where we get into various immune stimulants is that they're working on what we call our surface immune system. And so these are different immune cells that are active in allergies and sometimes autoimmune conditions. So people with allergies, I'm going to again put the caveat of saying like in your opposite ends of the spectrum, autoimmune and cancer and immune suppression and medications for those things, don't touch them. Or defer to a practitioner who can help guide you with some of those recommendations. But if somebody has like a slightly overactive immune system where we're seeing allergies and eczema, surface immune stimulants are a-okay. And I'd actually encourage them. And then echinacea has some unique properties for those individuals. Again, when it comes to autoimmune, it gets a little hairy and I can't give a straight answer because it's so case dependent. But again, in those allergies, use the echinacea, use the Risper Effect, barring there are no other contraindications to use that. So I hope that answered your question. Okay.
There was another one in here in the chat specifically. Are you available for direct individual consultation? I've been taking allergy, deep immune, and hepato-DR for a few years, and most recently echinacea and Effect, but I'm unsure whether this is overkill.
Yeah. Unfortunately, I practice within the jurisdiction of Alberta. So people who are outside of Alberta, I can't see for individual consultation. Sometimes we can help direct or guide people with general recommendations with products. So the allergy, deep immune, hepato-DR, those are beneficial things. They're not interacting with one another. The hepato-DR is something that generally is quite safe, that there are no issues with chronic use. Echinacea, Effect. So when we're talking about like all of the react approach, so pretty much anything that ends in "fect" for infection, those are short-term interval components, right? We're not looking to use them chronically or ongoing. So when I said I've been taking echinacea since 2015, that's been like I've used it twice a year for, you know what I mean? So we're not going to have continual use of echinacea or those other like Effect. What's beautiful about tinctures is they don't expire, right? They're an alcohol extraction. And so most of those ingredients are shelf stable. Again, there's some things that might shorten the shelf life, like glycerin, or other ingredients that are added. But I always talk about like, what's your herbal medicine cabinet look like? So echinacea just lives in my cabinet for when I need it. A Effect, like same thing, it would just be acute or as needed. But for like those longer term strategies, like is allergy, deep immune supportive for you? Should we tweak your protocol? Hepato-DR, liver health, like where do we find the utility and how is that best taken? That might be, again, kind of getting that comprehensive assessment to understand what you need eventually. But everything you're taking, like I don't have issues with you taking like the deep immune allergy or the hepato-DR. That wouldn't be an issue for long-term consumption. Yeah. Okay.
So that's it for the chat. I think
Okay.
we've covered all the questions in the chat, now just the Q&A.
Okay, super. Okay, so in the UTI, you say do not take if you have low or high blood pressure. I can't find more information on your website as to the reason. So bear with me. I'm just going to pull up the ingredients because I don't want to give you any misinformation about where that would come from. So the UTI Clear is the product name. And some of them, it's just like medications, right? So we don't know what medications people are on. So it's a Health Canada stipulation that we can't, if we say you're on medication. So the reason is the dandelion, straight off the hop, just having a peek at that. Dandelion, and if you're aware of the French word for it, pissenlit, which means pee the bed. So dandelion is a diuretic, right? So anytime we have a diuretic, whether that be botanically, nutraceutically, or we have it from a medication standpoint, the goal is to lower blood pressure. Again, when it's an issue of having a positive interaction, again, both are effective at lowering blood pressure. We don't want there to be an issue as to, like causing low blood pressure, because there are negative benefits to that, unless we're adjusting your medication accordingly, in which case we're monitoring that. Also, when it comes to diuretics and blood pressure medications, depending on the diuretic, we might deplete certain minerals like potassium. And so when we look at certain diuretics, we have to make sure that it's not affecting that mineral balance in the body either. So that would be the reason more than likely why it says for high blood pressure. Yeah. Okay, you mentioned Deep Immune is okay for those with high blood pressure, which is licorice free, but your website and product info says to avoid if you have high blood pressure. It seems many of your products have some kind of blood pressure warning. What are those of us who have high blood pressure supposed to help with our immune system if everything has a warning? The biggest thing is going to be consult somebody who's managing your medication or has some knowledge in herbs or both. The reasoning that it's a Health Canada stipulation, so any NPN or natural health product needs to come with certain warnings or stipulations based on the herb. Now, as a practitioner, I understand the risks or combinations of certain medications and herbs that can then inform me of what is going to be the most appropriate intervention for you. There are some either blood pressure medications or herbs that they're completely compatible, but we have to use it as a safety warning. So my best recommendation is consult with somebody who can review your medication and manage your blood pressure, but it can also recommend other things to help support your immune system. There are also, if there are contraindications in all of the immune herbs, which I don't think there would be. Sometimes we have to get a little bit creative because, like I talked about, there's a plethora of antimicrobial or immune stimulating herbs that are very effective. Might not be the most effective from a tissue specific standpoint, but we can get creative with some of those herbs, or we're looking at things that aren't herbs that are also going to stimulate or support your immune system. So I'm sorry, I can't give you a more concrete answer, but it's a liability standpoint.
Yeah.
And
And I just wanted to clarify on Deep Immune. So I did check our website. So the Deep Immune licorice free version does not have that contradiction.
Yeah, contradiction. Yeah.
With blood pressure. So maybe, I don't know, maybe he was looking at the Deep Immune original, which does. So just make sure that if you are looking for that protection and that Deep Immune product, that it is the licorice free version.
Yeah. Great. Thanks for checking that, Johnny.
Problem.
Okay. So once your products have been open, what is the shelf life? The best before dates is for unopened products. Should they be kept in the fridge just to make them last longer? How do I know when to throw them out? Okay. So tinctures, I would say like 10 to 15 year shelf life when they're open. There are some herbal practitioners, naturopathic doctors that have some tinctures from when they first started practicing, and that was like 10, 15 years ago. Still as good as the day it was bottled. That's the benefit of the alcohol, because not only is the alcohol actually being like extracting those constituents, is acting as a preservative. So short answer is like it's a fairly long shelf life. Again, if there's other ingredients in there, say the organic vegetable glycerin, that shortens the shelf life, and it just increases risk for contamination, and has a higher susceptibility to going rancid in a longer time frame. Now, if they, for a tincture, for instance, some herbs, and usually herbs with a lower percentage alcohol, because again, it has less of a preservative, and there's certain herbs that just the constituents denature more quickly. In those, they would never be harmful. Okay. And if there's any issues with contamination, it's either from a processing standpoint, which St. Francis will test every single tincture batch for contamination of bacteria or anything that could, and we would recall anything if there was ever any contamination, but we're doing that when we're actually bottling it, or it was you who contaminated when you had opened it, right? So if you're using the droppers, like don't put it on the counter, or don't put it like lick it, or you know what I mean, like put it directly in your mouth. That would shorten the duration, and it wouldn't be, in that case, you could harbor or grow bacteria, and that's an issue. In those cases, yeah, it would be harmful if there's contamination. But if it's a straight tincture, wouldn't be harmful. It would just lose its efficacy over time. And sometimes you can see that with change in pigment. Sometimes like if when you first open that bottle, like you could smell the herbs, and now that's significantly deficient, or we're seeing like you're not smelling the herb anymore, you can't like taste it, then we know it's probably just lost its efficacy at that point. And that's when I would throw them out. But yeah, I would say that shelf life is more of a suggestion for a lot of those tinctures. No, they don't need to be kept in the fridge. And I would say the only things that would actually potentially extend its shelf life if you were putting it in the fridge would be things that where we have the glycerin or the honey in it, but otherwise shelf stable. You can keep in the cabinet. We do recommend like keeping them in like cool and dark, just in regards to herbs in general, like whether that be tea or spices, cool and dark tends to be the best. And so that's one of the reasons why we use amber glass bottles, right? So it's to protect it from any type of UV damage that can denature some of those ingredients. So I think I got that. Opened, best before date, fridge, last longer, throw it out. Yeah.
There's another question in the chat. Why is there a best before date then if they last that long?
It's an NPN thing. It's a Health Canada stipulation. Yeah. So I think all of our products have a 5-year, I should say all of our tinctures have a 5-year shelf life. But as I mentioned, like they're good beyond that.
I believe it's 5 on the singles, and any of our formula combos, I believe, is a 3.
Okay. And yeah, and it might be if we're like adding glycerin, or there's honey, or there's like the colostrum or those kinds of things within the products, which will again shorten its shelf life. But individual tinctures, yeah, it's a thing. Yeah. Just like a bottle of whiskey, like it'll be fine over time. If anything, it matures and it tastes even better after 5 years. Yeah. If you can keep it that long. Yeah. But I think that is all.
That's it for questions.
Was that?
I think that's it for questions.
Yeah, that's it for questions. Okay.
I think we were here till like 8:30 last time we did.
Oh yeah. Oh yeah. Yeah. Well, I'm getting off easy then. Awesome. Well, thank you so much for your time and attention and your really great thought-provoking questions. I always love lots of engagement, lots of questions. And Johnny he's still looking to stump me.
You're just an amazing encyclopedia. So glad that you're on our side, on our team for sure.
Awesome. Well, thank you very much. And then, yeah, so there will be a recording. Johnny talked about that. And you just reach out to St. Francis for any other questions, or any of your store staff, because they'll be trained on these products. Okay. Awesome.
Thanks, everyone.
Okay. Bye now. Thank you so much.
Thanks.